great month, a little chilly and a little bit of snow, but good stuff, good stuff. We've had 20 additional deaths since Friday. Now, don't be, confused or led inappropriately with this, but we've had 20 additional deaths, and because sometimes over the weekend, it's not reported, as best as we'd like it to be reported. Nevertheless, we're up to 5,733 deaths. The 5,700th. Well, this can't be right. We've got a mistake here. We're up to 5,763 deaths. But the 5,744th death is a 56-year-old female from Mercer County. The 5,745th death is a 76-year-old male from Jackson County. The 5,746th death is a 72-year-old male from Ohio County. The 5,747th death of 79-year-old male from Jefferson County. The 5,748th death of 54-year-old male from Kanawha County. The 5,749th death of 74-year-old male from Harrison County. The 5,750th death of 42-year-old male from Roane County. The 5,751st death, an 86-year-old male from Monongalia County. The 5,752nd death, a 52-year-old female. The 5,752nd death, a 52-year-old female from Jefferson County. The 5,753rd death, a 74-year-old male from Pleasants County. The 5,754th death of 74-year-old male from Kanawha County. The 5,755th death, a 61-year-old female from Monongalia County. The 5,756th death, a 74-year-old male from Jefferson County. The 5,758th death, a 60-year-old female from Randolph County. The 5,759th death, a 79-year-old female from Mineral County. The 5,760th death, a 79-year-old male from Marion County. The 5,761st death, a 48-year-old female from Mineral County. The 5,762nd death, a 92-year-old male from Raleigh County. And the 5,763rd death in West Virginia is a 67-year-old male from Ohio County. I don't know how many times I got to say it, but 5,763 deaths in West Virginia. It'd be easy to let these people just become a number, but please, to God above, don't let that happen. Active cases are 15,490. Our new positive cases in the last 24 hours, 1,710. Daily positivity rate, we must have not tested much at all, was 17.46%. Our cumulative rate now is at 8.05. Our recovered cases are 425,518. That's bounced up, a good amount, and that's good. We have 1,064 patients in the hospital, 230 on the ICU units, and 116 on ventilators. Our red counties in our state continue to come down, and that's good. I've told you about, the discontinuation of two different types of antibodies, that FDA and I guess the CDC came out and discontinued, in the treatment of the Omicron virus. We do have antibodies that will treat the Omicron virus and everything, but two of the ones we were using, they discontinued. I've told you about the home test. You can get 4 free home tests by going to our covidtest.gov, and it'll direct you on how to get that. The Biden administration is also offering up 3 free N95 masks per person, and they will be made available at the pharmacies I don't think they're available quite yet, and it may still be that it's the tail end of this week or the first of next week before they're available for you. From a standpoint of a reminder, over 65, age and everything, any kind of health conditions whatsoever, any kind of feeling that you may have to where you're not feeling exactly right, please get a test. Please get a test. We can save your life and or at least significantly increase your percentages of making it through this thing if by chance you were positive. From the standpoint of wearing face coverings and everything, I'd highly recommend 65 and older to do that in settings where you were indoors with people you didn't know, and if you had some kind of pre-existing condition, you really got to be careful. There's nothing that I could ever tell you that is more impactful than if you're fully vaccinated and you don't have your booster shot, you're just not thinking right in my book. That's all there is to it. You got to get your booster shots. We continue to, make headway. We're now up to 70.8%. It was 70.7. We're at 70.8% of those 18 and older that have gotten at least one shot, and we're at 89.7% now of the 65 and olders that have absolutely gotten one shot, and we're at 82 instead of 82.3. We're at 82.4%. Of those 50 and older that have gotten their first shot, and that's good. We're making progress. It's slow, way slower than it ought to be, but at least we're making some progress. All the COVID vaccine info stuff is up on our website. I encourage you about the free testing. I always thank Fruth and Walgreens for all the good stuff that they've done all through the time we've been at this. We have 160 outbreaks in our long-term care facilities. We have one outbreak in our church community, and that's in Nicholas County. Corrections still has really high numbers, but not quite as high as maybe as they were, but we still have 714 inmate cases at 24 different facilities. I think that was at 27 on Friday, and we have 254 staff cases that we're still handling. I encourage you about your flu shot. You got to get that flu shot and everything, and absolutely you can get it at the same time you get either the COVID vaccine or the booster, either one. I have beat this drum a whole bunch, but absolutely without any question, if you're a renter or if you're a landlord, please contact us and we'll see if we can get you some of these dollars that we have available to us right now. I encourage you about giving blood over and over and over. I said just that. Check with your physician. See that it's safe. See that it's something that you should do and everything, or you should consider, especially if you happen to be one of these 425,000 that have recovered. You ought to consider this, but you take the advice and guidance of your physician. But if we can get a few more of you, over the finish line as far as giving blood, you'll save a life. It really helps. Really, really helps. It's a sad, sad, sad thing right here, but Senator Rucker lost her dad, and Senator Rucker does a great job in the Senate, and she served this state really, really well. We want to offer up our prayers in every way. This family's been through some tough stuff, so please, please, please remember her in your prayers. Senator Patricia Rucker, a great senator for this state, and she lost her dad, and we just hate it really badly. But Kathy and I offer up our prayers, and we'd ask you to please do the same. I've got two more things here real quick. One is I'd surely like you to stay tuned. When I come back to you on Wednesday, we'll have the final numbers on January's revenue numbers. We're trending in a really good way. And in this state, like I said, in the state, this state's really cooking. We're really, really doing good stuff. And this is just going to bring more and more and more goodness to West Virginia. You saw the big announcements of the gigantic companies that are coming and bringing more and more employment to this state. As we continue to pump out these good surplus numbers, that just enables us to do lots and lots and lots of more stuff for the people of this great state. And so I remind you, to stay tuned on on Wednesday, and we'll have the final numbers at that time. But we pretty much know what the revenue is right now, and it looks really strong. And I think we're going to be able to continue about on the same path that we were in the month of December. But those numbers are unprecedented. You know, if you'll go back, way back, you know, here a couple of years ago, we had a surplus, I think, in the month of July of like 32 million, and then came right back behind that in the month of August with a surplus of 34 million and change. And my goodness gracious, we thought we were absolutely it. That's all there is to it. And then we dropped off some a few months and everything, but we ran across the finish line with a surplus, not a lot, but right now, I mean, this train is rolling. That's all there is to it. And so stay tuned on Wednesday. And I've got one other announcement, but West Virginia has joined two other Republican governors, the Republican governor from the state of Tennessee and the Republican governor from Virginia. I was contacted over the weekend, you know, by Governor Youngkin, and we discussed this at length, and then I've had a lot of discussion with my people. But the bottom line of the whole thing is just this. The Supreme Court mandate on our hospitals and hospitals in general, you know, that all the staff, all the healthcare people have to be vaccinated or basically terminated. That's just all there is to it. It is putting an additional level of strain on our rural hospitals that is just destroying us. And maybe I misspoke on the Supreme Court. It went to the Supreme Court, but it was a Biden mandate. But it went to the Supreme Court for interpretation. And basically, from what happened in the beginning, it's been upheld. Now, the problem is just this. You know, maybe we can live with that in our more populated areas, you know, of our hospitals. But living with that in rural West Virginia, you know, where we truly do have some folks that are going to have to be terminated and everything because they just choose not to be, you know, vaccinated, you know, what is that really going to do? It's going to make it tougher and tougher and tougher for us to provide care in our rural hospitals. So I am joining, you know, the governor of Tennessee, the governor of Virginia today, you know, requesting a waiver from the CDC, from the Biden administration, you know, for rural hospitals to be able to not have to abide by this mandate. It is only putting additional pressures. It is not saving lives. It is not helping people. In this situation, it is hurting us and hurting us in a bad way. So I'm joining these two other great governors, and I salute their efforts and everything. And we'll offer up this. We hope it's not a Hail Mary, but nevertheless, we hope it's just a good, solid play that we're able to get a completion on and be able to help our rural hospitals, because, you know, providing care in a rural area is tough enough, but if we have to lose additional staffing and everything, it makes it dadgum near impossible. So like I said, I commend those great governors, and I thank them, and we're going to join them and try to see if we can get this across the finish line and be able to help our people in rural West Virginia even more. So thank you so much. That's all I got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning. In support of what the governor has just shared with us, we still see Omicron as the dominant variant in West Virginia. Our most recent sequencing run found that 95% of new cases, and we about doubled the run. So we tested over 600 new cases and found that Omicron was a dominant variant. We also see that today, for the first time since we have been challenged by this new Omicron wave surge, that our RT value across the state has gone under 1. It's 0.97 today. And that is generally an indicator for us that the transmission of the virus is starting to slow And we see that the number of cases over the last several days seems to have plateaued, at least related to the percent positivity rate. As the governor said, the new cases are down, but also the testing was down over the weekend. So we will wait and see how that stabilizes. But for the past 7 days, we have seen a net reduction in the number of new cases on a 7-day rolling average, which is encouraging for us. We also know that in other states and in other countries, as the cases start to plateau, we know that hospitalizations still follow and generally will still increase. As the governor disclosed today, we have newest updated numbers are 1,070 West Virginians in hospital beds, which exceeds our all-time high of 1,012. And as we start to look at the relative numbers of people in the hospital, we see that about 70% are fully vaccinated and about 30%, 70% are unvaccinated, about 30% are vaccinated. And we are looking into understanding, are those people boosted as well? Because when we look at the vaccine breakthrough deaths, the people that had been vaccinated who have died, we see that over 92% of those people are over 61 years old. And we know that boosters are very, very important to protect people from dying. Remember, fully vaccinated and boosted Americans over 65 years old have 100 times protection against dying and a 49 times protection against hospitalization. If you talk about those same Americans with just 2 vaccines and no booster, the percent or the protection goes down to 17 times. So we know that boosters are really important, and we really implore our oldest part of our population, our over 65-year-olds and over 50-year-old population that currently have only 57% boost rates and 52% boost rates, to please go out and get your booster. Very, very important. Recent data reported would say that in the United States, if we were as vaccinated as many European countries are, for instance, Denmark, we would have halved, the number of hospitalizations that we've seen during the Omicron pandemic surge. We also know that we are now over 880,000 deaths in our country. In the next week to 2 weeks, we will surpass 900,000 deaths and then 1 million deaths. And that to me is really a testament to the critical importance of people getting vaccinated, because we know in our country that 99% or so of the people that died through the whole pandemic have been unvaccinated. So really, really important that people get vaccinated. Lastly, there is a second variant of Omicron that has caused some problems in other countries. We have not seen that variant, the so-called BA.2 variant of Omicron in West Virginia, although it is in some states in the country. The important understanding about this is that full vaccination protects against that variant, just like it protects against the BA.1 variant, the variant of Omicron that we are dealing with. So full vaccination is protective. Whether or not getting better from Omicron is completely protective is still not known. However, it's likely that there still will be some immune response. So this is not to scare people, but just to recognize that COVID is not done mutating yet, is not done finding ways to bypass what we're doing. So really important for everybody to get vaccinated and boosted, but particularly for our over 50-year-old population and our over 65-year-old population. Please get boosted. That's going to make a big difference. It's going to protect your life, protect our hospitals, and eventually this is the way that we'll be able to go to an endemic mode for COVID-19. Thank you.
All right, thank you, Dr. Marsh. Next to Dr. Ayn Amjad, our State Health Officer.
Good morning. If you test positive for COVID-19, staying home and taking care of yourself is very important. So if you're able to use a bathroom that's separate from the rest of your household, that's very important. When you do go out into the rest of your household, to wear a well-fitted mask. and to also notify anyone who you've been in close contact within the last 2 days of your symptom onset. Anyone who's defined as a close contact is someone that you've spent at least 15 minutes or more within the last 24 hours. And someone that we define as a close contact is within 6 feet. So maybe definitely someone within your household, maybe someone that you've shared workspace in, that's someone defined as a close contact. And you'd like for that person to also get tested. You'd also want to contact your medical care provider and let them know that you've tested positive for COVID-19. When you'd want to seek help or maybe go to the emergency room is maybe if you have sharp chest pain that isn't going away, new confusion, inability to stay awake. We talk about someone who has, cold fingertips, they're turning colors, and maybe you're having really difficulty breathing. You'd also want to tell your provider if you maybe qualify for any of the antivirals or other therapeutics that we've mentioned on the briefing. Thanks, Jordan.
All right, thank you, Dr. Amjad. Retired Major General Jim Hoyer and Secretary Bill Crouch had prior engagements today. They will rejoin us on Wednesday. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking my question. Good Monday morning. First of all, have we heard anything back from the CDC about a request for the second booster? If they never get back with us, what's to stop the state from making its own order and issuing those shots on its own? And also, you mentioned endemic, Dr. Marsh. What's going to be the criteria for us to get to that, where we start dealing with this like it's not that the outcome is exactly the same, obviously, but like it's a flu virus where we treat it on an annual basis rather than this constant code red that we're in that, frankly, we can't sustain indefinitely. Thank you.
First of all, Kenny, let me say, you sound kind of hoarse. Are you feeling bad yourself?
I don't know. I'll have to get that checked out.
Well, I hope not. I hope and pray not. But nevertheless, Kenny, we have not received and I call it a substantive response, from the Biden administration on our request. Dr. Marsh can add to this and everything, and surely the back part of your question, but we're still looking for a response that's just not lip service. I mean, but Kenny, in being anything but critical, you see what's going on in D.C. and you see the advice comes out, and then we completely do a 180 and we go another direction, and that's created a lot of doubt in a lot of people, and that in itself has caused so much trouble. It's unbelievable. But Dr. Marsh, maybe you can answer a little bit more about this.
Thank you, Governor, and thank you, Kenny. Kenny, we know that from data from Israel that the fourth vaccine, the second booster shot, was able to reduce hospitalizations by 3 times in people over 60 years old at risk, and reduce the risk of new infections by 2 times. And certainly as we go forward, we very much, as I mentioned earlier, implore all of our older West Virginians who haven't done it yet, please go get your booster. Really important, because remember, the first 2 shots of the vaccine series, whether it's Moderna or whether it is Pfizer, are very close together, which some people think, instead of one acting as a priming dose to get everything ready, and the second as a boosting dose to remind everybody to boost the immune system, that these 2 doses may well serve as prime dose 1, prime dose 2. So we may well need a booster dose to get the maximum benefit of that vaccine series. And as I said, the people that we know are in the hospital and are dying from COVID-19 who have had 2 doses oftentimes are older and lack that booster dose. So the booster dose is really important. When it comes to turning from pandemic to endemic, it's really, to me, a complex question. Number one, it has to deal with our attitudes and behaviors. And I think for a lot of people, they've made that turn where they are willing to take some risk, live with the virus, dance with the virus, as we've talked about before. But importantly, we need enough immune responsiveness from enough of our population that instead of having new variants circulate dramatically across the world, as we saw with the Delta variant, now we're seeing with the Omicron variant, that there is enough residual immunity that it stops that worldwide spread and isolates the spread into much smaller areas. And I think that many people are hopeful that because of the incredible infectivity of the Omicron variant, it's estimated that perhaps as much as 40% of the US population will have been infected and have some immune function to the Omicron variant when it is finished circulating in our country, that residual immune capability will slow things down. But as we've many times experienced with COVID-19, when we expect COVID to take a right turn, it takes a left turn. So a lot of this capability for us to move to that endemic status will be dependent also on how the COVID-19 virus mutates and whether new variants come up that are more resilient and less responsive to the immunity we have today.
All right, thank you, Kenny. Next, we'll go to Evan Bevins with Ogden Newspapers.
Thank you. I was hoping to hear from Dr. Marsh and Dr. Amjad their thoughts about the request for a waiver for the rural hospitals. Obviously, there's logistic issues there, but from a healthcare standpoint, what the impact and the needs are for that. Thank you.
Dr. Marsh, please, and Dr. Amjad join in as well.
Thank you, Governor, and thank you, Evan. The governor is really articulating a very challenging problem that we have related to staffing. And staffing is a problem in all hospitals, both from the perspective that some workers have decided that things are getting too difficult and are moving to other professions, but other workers either have COVID right now or have been exposed to somebody with COVID-19 and are isolating or quarantining, particularly those that aren't fully vaccinated. And as we look at the really severe staffing shortages, I think the governor and the governors of Tennessee and Virginia are trying to weigh that sort of risk-benefit ratio, because of course we want to see as many people vaccinated and boosted as we possibly can. But that balance between making sure that we can keep the doors open in these rural hospitals and making sure that everybody is fully vaccinated and boosted is a difficult challenge in some areas. So I will certainly bow to the governor's wisdom as the leader of the state to try to balance that. And as the governor articulated, the three governors asked for a waiver as opposed to edicted anything. So I think it will be really important and interesting to see how this works out. But certainly we do understand that there is many higher and more vulnerabilities to staffing in rural parts of our state than it is in more urban, larger parts of our state.
I think 2 years into this pandemic and, us having the vaccine and in rural areas, I think we face challenges that bigger cities don't face. So I think we're at a point where we have to make decisions that are going to suit rural areas that maybe bigger cities don't see. So I think we have to make decisions that are best suited for areas such as West Virginia and rural areas that maybe bigger places don't see. So I think these are just decisions that we're going to have to face and make and go with them because we have to make them for patients in these types of populations.
All right, thank you, Evan. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I was hoping we'd get a little advice from the medical folks about the federal in-home testing that people are starting to receive. I know the first batches have gone out. The governor and others have encouraged people that feel like they have, a cold, tickle in their throat to take a test. Is that what these at-home tests are for? When should you use them, and when should you seek out the other tests? Thank you.
Docs, y'all go. You guys got the ball here.
Do you want to start and I'll follow up?
Sure. I would say yes, because right now that is some of the symptoms that you would see, Charles. I mean, right now, if someone is having a sore throat, congestion, a headache, we are advising you to go ahead and take a COVID test because the symptoms are so vague. Part of the push of the federal government to get those at-home tests out there are because that the tests, if you are to go out to a COVID testing line right now, they're so long. So we're trying to put these at-home tests in your home so you can get them done quicker. So if the test is positive, you're not out there spreading COVID. That being said, they are limited as well. There are not so many that are going out, so we don't want you to use them maybe irresponsibly. But you know, I'm not going to say don't use it because those are kinds of the symptoms that we're seeing. So, maybe if you have a high risk exposure, maybe you're out and about and you hear something, but I wouldn't say don't use it either. So it's kind of a tricky question, but I know right now, if someone is congested, we're telling you to go ahead and use it. So I don't know what kind of advice Clay would give, but I would say yes, use it because that's what the purpose is. Those are the type of symptoms we're seeing and people are testing positive. Clay.
Yeah, so I'll just follow up briefly. I think Ina is correct. Charles, we would recommend that people go ahead and use a rapid test if you have those types of symptoms. We do know, however, that sometimes early in the process of COVID infection, the rapid test might test negative. So if you have a persistence of symptoms and your rapid test is negative, then you should go ahead and follow with a PCR test. If your rapid test is positive in the face of symptoms, then that should be felt to be just as good as a positive PCR test, and you should start to isolate. The other use of these tests would be after 5 days or so of isolation for a positive test, then retesting yourself at 5 days with a rapid test can be helpful. If you're still positive, you may want to go ahead and stay in quarantine for at least day 6, day 7, and you can either test yourself on those days consecutively or wait till day 7 to test yourself. We know from the MBA assessment that at 5 days, people will be somewhere between about, let me rephrase that. At about 5 days, about 35 to 53% of people who tested positive, say by rapid test or PCR test with symptoms, will remain still communicable. By 6 days, that goes down to about 20 to 30%. And by 7 days, that goes down to 16 to 22%. So we know that there is still a group of people who test positive with PCR or with antigen that can still transmit the virus by day 5. So that's another use for the rapid test. And if you're negative at day 5, then you should feel good about going out and wearing a mask, a well-fitting mask for the remainder of that next 5 days to make 10 days total. Thank you.
All right, thank you, Charles. Governor, I'll turn it back to you.
Okay, in going through my stuff, I think Dr. Marsh kind of updated the hospital number from 1,064 to 1,070. Either way, record number. From the standpoint of, asking for that waiver for our rural hospitals, that's been explained two different times, and really, I am very hopeful, even though it may be somewhat of a Hail Mary pass. I am still very hopeful that it would be considered because and granted, because our rural hospitals, we do not. I mean, we're overloaded right now, and we can't afford to lose anybody. We can't absolutely afford to be firing people and everything. I don't think that there's any place to be doing that. We should be respectful of their values and what they stand for, but we should encourage them. We should encourage them in every way to be vaccinated. There's no question whatsoever, in my opinion, about that. But nevertheless, we can't shut the hospital down. That's all there is to it. We've got people that are a long ways from anywhere, and their hospital is absolutely essential to them. And so we need that waiver granted, that's for sure. From the standpoint of sending up additional bills, I think we've got 10 plus additional governor's bills that are going up and everything. We wanted to wait till after the state was given. Once, I came down with COVID and everything right the day before, and we had to cancel, and it surely wouldn't have been safe for others to have been here, and there's no way on the planet that I could have possibly been here. And so with all that being said, we got a bunch of governor's bills that are going up, and they're going up right now. One of them is a bill that relates to the terrible drugs, scourge that's going on all across this country, and but with that being said, what's happening is just simply just this. By us having an out-and-out collapse at our southern border, I mean, let's just, I'm just eat up with all the time telling the truth. But what's happened is our southern border has collapsed. And the bad guys from all around the world, whether they be from China or Mexico or wherever it may be, the bad guys know it. And the bad guys that are wanting to infiltrate us for bad stuff, such as drugs, the fentanyl, and all that stuff, this is the gateway, the absolute gateway. And so what happens is it floods into this country. And once it hits this country, believe me, it just doesn't stand and hang out right around the border. It goes and infiltrates this country all across our land. And it has come to West Virginia in every way you can imagine. Now just look at this. I want you to pay really close attention to this. But this just came to my desk, just came. But now just think about it. Basically what it is saying is right up here, and you may not be able to read it, but it says, one pill can kill. And then it goes on to talk about the counterfeit pills that are coming into this country. They're coming into this country from the standpoint of the, counterfeit pills, that is oxycodone. That you may think from oxycodone that, it's a pain pill. I've got all this pain and everything. You take it, and it may be very well laced with fentanyl. Now get this right here. They said so far this year the DEA has seized 20 million counterfeit pills. And then it goes on to say more than the last 2 years combined, and these pills are often laced with fentanyl. In addition to that, if that's not bad enough, they have marijuana that they've gotten that has been laced with fentanyl. The long and short of it is just this. We are sending up a bill right now cracking down even harder with absolutely more stringent things and a more stringent crackdown. And it was all these bills were put together weeks and weeks ago. But we're sending up, and all these bills will be going up in the next couple of days. But with all that being said, we are sending up another bill asking our Senate and House to give us in Homeland Security another level of sledgehammer to these god-awful people that are bringing this poison to our state and to West Virginians. So lots of good stuff going on, but I would warn all West Virginians from the standpoint of pain medication, from the standpoint of marijuana, from the standpoint of whatever it may be, whether it's you should be doing it or you shouldn't be doing it, you have got to weigh in the fentanyl component to this whole thing right now. Because one dose, one pill could very well kill you. Absolutely, please take caution in every way. Last thing I've got is this, and I oftentimes think about this and everything, but I watch Dr. Amjad and Dr. Marsh. Now let's just be real and be fair. Both of them had a great professional life as well as their families. A great professional life. And the work that they've done medically in their lives and everything, or whatever it may be, is off the chart. And what did both of them do? They decided to give up a lot of their life, to give up a lot of their professionalism and stuff that they were doing and serve West Virginia. So whenever you see them, or you could drop them a card, thank them. Because my gracious, they have been fantastic. They have been better than fantastic. And so I just love them to death. And I sit here and just think how blessed I've been, but how blessed the state of West Virginia has been to have them. You know, and here they are today, and here they've been day after day, and they work 24/7 all the time. And you know, so many as well, but I just watched them today, and I just wanted again to thank them, and I thank them from the bottom of my heart, and I absolutely, you know, in every way ask all West Virginians, if you see them, or it weighs on you to send them a card or whatever like that, do so. They have done so much. They have been so good. So special thanks to both of them. Thank you guys, and that's all I got. God bless all of you.